Welcome to another issue of OpenAnesthesia Sustainability in Healthcare series. Today, we will introduce healthcare waste. Today, we're focusing on key healthcare waste management topics, identifying the types of waste generated in operating rooms, understanding the full scope of healthcare waste, assessing the impact of healthcare waste on the environment and costs, and exploring actionable steps to minimize medical waste generation. Let's explore some crucial questions related to healthcare waste. What is the impact of medical waste on the environment? How much medical waste do we generate? What materials make up medical waste? How serious is the issue of medical waste? And where do we start in our efforts to reduce medical waste? What are the environmental impacts of medical waste? Improperly disposing of healthcare waste in landfills can contaminate our drinking, surface, and groundwaters, especially when landfills aren't constructed properly. Similarly, if healthcare waste is treated with chemical disinfectants but not managed correctly, it can release harmful substances into the environment. Incinerated waste can result in air pollution and toxic ash residue. Decomposing medical plastics contribute to pervasive environmental microplastics. When materials containing or treated with chlorine are burned in the incineration processes, it can produce dioxins and furans, which are harmful and known human carcinogens. Additionally, toxic metals such as lead, mercury, and cadmium can be released into the air. Modern incinerators that operate at temperatures between 850 to 1,100 degrees Celsius and are equipped with special gas cleaning technology can meet international emission standards to remove dioxins and furans safely. Consider alternatives to incineration, like autoclaving, microwaving, and steam treatment. These methods minimize the formation and release of hazardous emissions, providing safer options for managing healthcare waste. The medical waste crisis. So, here's the breakdown. About 85% of the waste produced from healthcare activities isn't hazardous. It's the other 15% that's a concern, containing things like infectious, toxic, or radioactive materials. Now, globally, think about the staggering amount of 16 billion injections given every year. If those billions of needles and syringes aren't disposed of properly, there's a real risk of injury and spreading infections. When healthcare waste isn't handled correctly, and methods like open burning or incineration are used, dangerous stuff like dioxins, furans, and other pollutants that can harm both people and the environment are released into the air. Ensuring that healthcare waste is managed safely and in an environmentally responsible manner is vital. Why? Well, because it's all about preventing any harmful elements, chemicals, or biological hazards from getting out into the environment. When we manage waste properly, it's not just about keeping our surroundings clean. It's about looking out for everyone's health, the patients, healthcare workers, and the surrounding population. By doing this right, we're minimizing the chances of anyone getting exposed to dangerous materials. The United States, healthcare systems collectively generate approximately 6 million tons of medical waste annually, posing significant environmental challenges and financial burdens. For context, an average hospital produces about 29 pounds of waste per bed per day. This considerable volume is largely attributed to the pervasive use of disposable single-use medical items, driven by both regulatory requirements and the rapid evolution of medical technology. As a consequence, leading healthcare institutions in the U.S. find themselves discarding an estimated $15 million worth of unused operating room supplies each year, underscoring the economic implications of inefficient resource utilization in the healthcare sector. A recent study by researchers at UCSF revealed alarming findings regarding the substantial financial impact of waste in healthcare settings. Their investigation uncovered that nearly $1,000 worth of supplies were discarded per procedure at their academic medical center. Extrapolating these figures, the waste accumulation could reach a staggering $2.9 million annually within UCSF's neurosurgery department alone. These findings shed light on the broader issue of waste generation in operating rooms across the United States, where over 2,000 tons of waste are generated daily. While some of this waste is biologically hazardous and necessitates proper disposal, a significant portion comprises reusable or donatable supplies, highlighting the potential for cost-saving measures and environmental stewardship within healthcare facilities. Now, let us discuss how medical waste is a multifaceted issue that can be categorized for better management. In operating rooms, the majority of solid waste belongs to the category of municipal solid waste, or MSW, which is usually free from contamination or hazardous substances. MSW includes materials such as paper, plastic, cardboard, and intact glass, with a notable portion comprising packaging materials essential for maintaining supply and equipment sterility. Disposal of MSW typically involves placing it in designated bags, often white, clear, or black, which are then sent to local landfills or incineration plants for proper disposal. While some MSW items may be recyclable, their recycling largely depends on the availability of local vendors equipped to handle clinical materials and recycling processes. Regulated medical waste covers materials produced in healthcare settings that could potentially pose infection or other risks to human health and the environment. This category includes sharps like needles and syringes, pathological waste such as tissues and organs, microbiological waste like cultures and stocks, and blood-contaminated items. Ensuring proper management of regulated medical waste is crucial to curbing infection transmission and safeguarding public health. The rules regarding how medical waste is managed, treated, and disposed of can differ depending on the area and are usually enforced by health departments or environmental agencies. Healthcare facilities are required to follow particular instructions for sorting, packaging, labeling, storing, transporting, treating, and getting rid of regulated medical waste to guarantee safety and meet regulatory requirements. Every year, healthcare facilities in the United States produce around 1 million tons of clean, non-infectious plastics. Alongside plastics, materials like metal, paper, and cardboard are also commonly recyclable, adding to the recycling potential within healthcare settings. Anesthesiology waste makes up about a quarter of the total waste generated in operating rooms, and roughly 60% could be recycled. A significant portion of recyclable waste is generated before the patient enters the operating room, when cleanliness and suitability for recycling is optimal. Since 2017, China's ban on importing plastics and paper waste has had a ripple effect on recycling programs globally, resulting in a drop in national plastics recycling rates from 9% to 5 to 6%. To bolster program resilience and offset the impacts of international disruptions in recycling supply chains, it is essential to forge partnerships with local plastics manufacturers and recycling vendors. This approach can help ensure continuity and sustainability in recycling efforts despite external challenges. In medical equipment, batteries play a crucial role, but they often end up as single-use items. Batteries are packed with hazardous metals like lead, cadmium, and mercury. Their disposal is a critical concern, requiring specialized methods to prevent environmental contamination. To address this issue, the Battery Act came into effect in 1996. This legislation tasked states with developing programs to collect, transport, and properly dispose of batteries, ensuring the safe handling of these potentially harmful materials. Furthermore, some states have gone a step further by enacting laws that mandate the recycling of disposable batteries. These measures aim to encourage environmentally responsible practices within the healthcare sector, reducing the environmental impact of medical waste disposal. Sharps waste, which includes needles, syringes, even those without needles, blades, and broken glass, presents a significant risk of infectious cross-contamination in healthcare settings. Managing the disposal of sharps waste is crucial due to the inherent danger of infection transmission. To ensure safe disposal, sharps waste should be placed in dedicated red sharps containers or specialized bins specifically designated for sharps with pharmaceuticals. Practitioners should be familiar with the rules at their institution and state level. This helps minimize the risk of accidental needle sticks or exposure to potentially harmful pathogens, safeguarding the health and safety of healthcare workers and the public. Pharmaceutical waste is classified under the Resources Conservation and Recovery Act, or RCRA, which categorizes it based on its level of hazard. There are three main categories: acutely hazardous, P-listed, non-acutely hazardous, U-listed, and unlisted pharmaceuticals. P-listed pharmaceuticals, such as nitroglycerin, physostigmine, and nicotine, require special treatment due to their high level of hazard. Disposal bins for these substances are typically black, indicating their hazardous nature. U-listed or unlisted drugs, on the other hand, may have dedicated disposal bins that are colored purple and white, or blue. These bins are used for the safe disposal of pharmaceutical waste that poses a lower level of hazard. Disposing of controlled substance waste requires careful handling to prevent diversion and abuse. In the past, this waste was often poured down sinks under supervision, but this led to environmental contamination and risks of exposure since sewage plants aren't equipped to handle pharmaceutical waste. The Resource Conservation and Recovery Act, RCRA, includes an EPA sewer ban that forbids healthcare facilities from flushing hazardous waste pharmaceuticals, safeguarding water quality and public health. Nowadays, facilities should have special bins with solidifiers to make controlled substances unrecoverable. This eliminates the need for sewage dumping, discourages abuse, and helps minimize environmental damage. Addressing medical waste. How to get a visual aid for the hospital. To ensure proper medical waste disposal, hospitals can obtain visual aids by contacting medical waste disposal service providers, requesting specific materials, and consulting state and federal resources such as the EPA. Additionally, many companies offer free downloadable guides and posters to assist healthcare facilities in complying with regulations and maintaining safe waste management practices. The concept of a circular economy is essential in addressing medical waste by promoting the reuse, repair, and recycling of products and materials. This approach helps mitigate waste, contain emissions throughout the product lifecycle, and create supply chain resiliency. For example, reprocessing medical devices reduces costs and pollution. In the operating room, advocating for reusable items over disposables can significantly reduce healthcare waste. Items like laryngoscopes, circuits, blood pressure cuffs, gowns, drapes, and textiles are excellent candidates for reuse, leading to a more sustainable healthcare environment. Let's advocate for practices that aim to reduce waste volume and ensure proper segregation. We need to develop strategies and systems backed by strict oversight and regulation to improve waste segregation, destruction, and disposal practices, meeting both national and international standards. It's crucial to prioritize safe and environmentally friendly treatment methods for hazardous healthcare waste, such as autoclaving, microwaving, steam treatment with internal mixing, and chemical treatment whenever possible, rather than resorting to medical waste incineration. We should establish a comprehensive system that addresses responsibilities, resource allocation, handling, and disposal, ensuring gradual improvements over the long term. This way, we can effectively manage healthcare waste while minimizing its environmental impact. Let's start by spreading awareness about the health risks linked with healthcare waste and advocating for safer practices. We should prioritize waste management options that are both safe and eco-friendly to safeguard everyone involved from potential hazards at every stage of the waste management process. While government commitment and support are essential for achieving universal, long-term improvements, we can also take immediate action at the local level to make a difference. Here are the key takeaway points. Operating rooms contribute to around 30% of total hospital solid waste. Continuous education for staff is crucial for better waste disposal segregation. Effective waste stream management helps in lowering environmental and financial burdens. Embracing the circular economy principles aims to minimize waste by maximizing material use and sustainability. Contributors to this session include medical student Brandon Foster, Dr. Carole, and Dr. Jacklyn Monk. Here are some references for your information.